So good morning, everyone. Morning. Before I start, I wanted to say thank you to Diana again. She actually reviewed my PowerPoint, and in this industry, you have to be comfortable with people looking over your work and always constantly looking over your shoulder. We know when you start, you're always going to be a performer, a reviewer, and there's always someone that approves your work. And I was very comfortable going up to my Diana. I was like, would you like to come and look at my work and see what's going on in there? And she said, hands on, she said yes. And she was able to fine tune this presentation for you guys. So thank you, Diana. So this is my introduction. I came here. I used to sit right over there and over here. And I started as just like anybody else in a nursing program. And then from the nursing program, I went to the microbiology class, and that's where I met Dr. Aurora. Dr. Aurora had like the biggest turnout I've ever had for just one class. She had literally students coming out into the line, and it was unbelievable what I just saw. And this was only because people heard her from word of mouth and because I rate my professor. And from that moment on, I knew I have to stay with her because this professor really cares for what she does. There's other professors and teachers you grow up and you could tell that they don't care what they do. You know, they're just there for a paycheck. Dr. Ro's not there for a paycheck. And that's what I noticed. And I was like, you know what? I need to be here. And there was people literally crying, wanting to be in that class and staying in there. And I was like, you know, I need to make the best out of it. You know, I need to give it my all. And then that just shows you, like, if you can give it your all, you guys can achieve so much more. And I have a testament to that because this is where I came from. I came from Mission College, got a job at Thermo Fisher. That was my previous job. And then I was there for 1 year. And then from that 1 year, I was able to help Diana get a job right after. And she took my position, which I'm very glad that happened. That's a pointer? Oh, okay, cool. There you go, pointer. And then I went from an assistant to an actual technician from a year at Cedars. And this is my job there at Thermo Fisher. That's the filling department. You know where that's at, right? And this is my team. So that's Lauren. She's probably gonna be the one, that's like general manager. She's probably the one that's gonna be doing most of the interviews. That's Pankiel, he left. That's Susan, she's very nice. Pankiel was in the facilities. And then that's Kiki, she's administrative. That's Lewis, he was in R&D, and then now he moved to QC for a little bit. That's me, and I don't know who that guy is. He was there to take a picture. We were there like taking pictures of the lab, you know, very rare moment. So it was quite an experience being a part of a commercial that I was there. I don't know if you can ask Drew for that commercial. I'm on there. Okay. So hopefully we could start out with a little icebreaker. So you can start out. This is something that's put, attention to detail. Which logo is correct? Come on, you guys. Right or left? Which logo is correct? Right or left? Come on.
Right. Right.
Right or left?
Left.
Because the bulls have to be red.
Oh,
That would make sense of that.
that's.
Left.
Left or right?
Left.
Left because the right one looks like it's dead.
Yeah, I know. The eyeball. Oh. Right. No, left. Oh.
The difference is too subtle.
Oh.
And everybody knows this one, right?
Right. Left.
I don't really pay attention to Cheetos. I don't like Cheetos. I don't really care about Cheetos.
Oh, that's
No,
left.
Left?
Unless it's right.
Left.
Damn it. Oh, that one's hard.
It gets harder, doesn't it?
Again, this is not a product I buy, so I don't know.
Oh, it's just.
All right, I'm gonna stop it there because it's gonna go on for like 2 minutes. But you get the idea, and that's the whole point. Because like in this industry, you're gonna see a lot of things, and you have to have a really good attention to detail. And I know this is sometimes you don't see all this stuff all the time, but sometimes you will. And your bosses are gonna expect you to know some of this information, and not just the information, the stuff that's right in front of you. You know, when you're moving around and hovering and like getting something like a pipette or something like that, like, are you gonna get a 200 or are you gonna get 1,000 pipette? Like, you have to make sure what you're doing and always be aware. You know, this is, you know, a fun little game, and that's sort of like what I'm trying to like teach you guys. I go to the next slide. All right, there you go. So right off the bat, you guys know what ADP is? You guys work, right? You guys are in the industry already? That's the one that actually pays your paycheck. So when you get hired, a lot of employees, they have to, you know, it costs them money. So on average, the business will probably pay like $4,000. At Cedars, it's probably way more. Because, you know, they do a lot of background checks and they take away your blood and stuff like that. They do a lot of tests, and there's like a lot of hiring process. They got to pay people to look into you, and then there's also time that they have to like invest in you. So you have to make sure that this is something that you want to do and that they're hiring the right person. They don't want to hire someone for like 6 or 8 months and the position is like a permanent position, because that would be a bad hire. You know, that's something that they're thinking about, and that's something when you're in those interviews or anything, or when you want to move, or when you're in the industry, like you have to make sure that like you understand that they're investing time in you, and just the same thing that Dr. Aurora invests time in you, you better invest a lot of time with her. And training also is very costly. This is like Indeed, and then that's what it tells you how much a training will cost. I think this is like way more, especially at the CBC, that training is gonna be very costly. And especially like all these supplies, somebody has to pay for them, and they have to make sure that you're able to like perform at a high level. And with this program, what I like about this program, what drew me into this program, was I can actually work and actually at the same time learn at the same time. And it's just amazing that like what's instilled in this class is definitely instilled at Cedars, where they really want you to succeed, and that same way Dr. Aurora wants you to succeed. Now, why do you want to work here? I'm sure you got that question every interview, right? Is that the first thing that they told you? Yeah, so the first thing they'll tell you is like, you have to learn with a growth mindset. And that 70% is on the job experience. So this is something that's going to be a recurring theme that Dr. Aurora has always told me. And I didn't really grasp it until I got working in the industry, where she says, she will teach you the basics, but then when you move into the industry, the basics get you the job, and your ability to adapt and consistently learn will make you last in this industry. And on top of that, will make you more valuable. And you want to be valuable. You want to be kept. And that's what they want out of it. And the rest is like informal learning and informal learning, which is basically just like, you know, teaching yourself and everything with all the reading, and can you teach others. But really the hands-on work is what drew me into this class and drew me into this industry, and what drew me to Cedars and Thermal. And this is something that they look for when they're doing those interviews. Like, are you there? How engaged are you? Like when you start working and when you're in that probation period, you know, do you just want to work there for survival? Like, is just like a regular job for you? Because I used to have that. I used to work at, you know, FedEx and Amazon, and I just wanted to work, you know, just for the money. But then I felt like I wasn't there, so I decided to go back to school and everything, and I wanted a sense of belonging. And then that's where I felt like when I was in this program, that like I felt a sense of belonging in the program. And that's where I was in Thermal, and then this is where I am at Cedars. And that's what the companies want to hear from you. You know, are you an achiever? You know, are you there for a growth mindset? Are you going to be able to work with others? You know, do you have the drive to be persistent? Because eventually you will get better at the job, and it does get better. And I can promise you, like, you know, if I can make it, all of you guys can make it. There's like, I wasn't always the smartest, But I was also like aware that if I pushed hard and I worked hard, I can actually, pass the class and everything. And I know if I didn't mention this, not only will my boss at Cedars would get mad, but Dr. Aurora would get upset not knowing that Cedars is the #1 in California and #2 in the nation in customer service, because we actually care for what we do. And as you can see, that's me, that's Andy, that's Ivan, and that's Joel. Now we added 2 more people. They're not in here because I didn't have time to add them. We added Crystal and Ignacio. And then there's also Ignacio in the other building. And they came after me. And the pressure for me was different from the pressure for them, and it's probably going to be different from the pressure for you guys, because with me, I was the guinea pig. I started out. I'm sure like they were kind of iffy on me, and I was really nervous too, and I was the first one there. And then like it felt like, all the program was like kind of resting on my shoulders, but I knew that like with my training and from Dr. Aurora's training, I can actually achieve so much more and help others. And that's why I wanted to come back here, and that's why I'm here, because if somebody did that to me, I can do that to some other people. Now, when you go in there, you want to see how much growth is there for expansion. Like Thermo Fisher, they have a lot of different departments and they're constantly growing. There's a Thermo Fisher here at Los Angeles, there's one in San Francisco, and there's also another one in San Diego. This is me when I was leaving. This is the pre-production team. So when I first started, I was there in tray production, and then after the 3-4 months, they moved me to filling, and then from like 5 or 6 months there, I moved into pre-production. And that's where I wanted to stay. But as I was fixing my resume to get a promotion and to get a raise, I decided, what, I'm gonna put my resume out there. I'm gonna see if Cedars was gonna take me. And they did. This is me at like literally the week of for Halloween. So I've been there a year. They had a lot more expansion because they were still technically a smaller department. It was still very startup. There was only like at the time I think 3-4 years of being there, and they moved from the hospital to an off-site off campus, or what they call it, off-site, because they were growing so quickly. And they continue to grow, and they want to bring more students from this program because they know that when they come from Dr. Aurora's program, they come with the knowledge, and they come with the drive, and they come with the pipetting skills, and they come with like the attitude that they like. So this is Dhruv, and this is Peter, and that's Dr. Aurora, and that's me. So when you're in there, you're going to ask, what do you see yourself in the company going the next few years? What are your avenues to expand? What brought you to this company from your last place you worked? Tell me a skill you recently used from your last job that you're currently using in this position. That's something that when you're in those interviews or when you're in those working there, you got to let your boss know where your strengths are and your weaknesses are. Because we all have them. I have them. I do mess up sometimes. I do make mistakes, and I try to catch them as best I can. And I always try to find the positive in something that's negative. It's always there. And when it's there, when you see the positive, you really have to exploit it. You really have to know who you are and what you are doing and where your skills are at. Because there's 30 other people here, just like how it was when I first started, that were as good, if not better, on certain things. But I knew for me, I was always the hardest working. I was always the one that was trying to help other people. I was always the one that was asking Dr. Aurora, is there any other way I could look at this procedure or process? Is there something I can make it better? Like she knew like that was my best skill, and understanding that I really wanted to learn the process and the procedures and the experiments that I worked in. And that's sort of what I told them, and I felt like that was able to go through to them, and not just them, but like even Thermo Fisher or any other jobs that that you apply for. Now, what education to industry transition? So what are you bringing to the company? So like what I said was like the most important probably was GDP and SOP. So really understanding the procedure and the process is really something that you should really just stop and look at it again and see if there's something there that you may not have seen before, and ask your coworkers or even your classmates or whoever, like who's the top performer, and always look for them and always try to be as good as them. And what I learned here is basically like, which I don't know if you, how far you are along with the program, but you know, centrifugation, communication, attention to detail, Six Sigma, gimbal walk, and all this. This is what I did in Amazon. So I had that experience, on the job experience, and I had to explain to them in my interviews what that was. And you know, dilutions, I did that here, and I also did that at Thermo Fisher using the nano drop. And then because I use the nano drop at Thermo Fisher, I also have to use a different version of the nano drop at Cedars. So there's always going to be some aliquoting, and there's teamwork. That's very important, understanding that like where your skills are and where you need to improve in, and that's something that you will take over. And here, there's some labeling, boxing, checking trays, dotting trays, thawing the tube set, line clearance, pre-verification, post-verification, you know, SOPs, forms, sheets, data entry. That's all very important. That's all very industry driven. Like a lot of people may not like doing the data entry stuff, like, 'cause it's kind of boring. But for me, I find it very interesting because I actually like tracking what I've done before. So these are the departments that Thermo Fisher has that maybe you might be interested in, you know, like trade production, this is where I worked. Filling, packaging, warehouse, I was there under ULS, and pre-production. They also had an R&D, quality inspection, quality assurance, facilities. They had a serology department there. I was under different people, and they all understood that I was able to conduct myself and be able to operate with other people, because sometimes you have to understand that, you know, you are here with other people and you have to like get along with everybody, and that's very important. And understand that everybody has different backgrounds and different methods of doing the procedure. And sometimes your way may be a little bit more outdated, or maybe be a lot more different, or sometimes it may not be for you. And that's something that you actually have to like judge for yourself and be the best judgment of like the experiment that you're working in. And at Cedars, they have like, these are some of the departments that are there. If you're interested, they have the core, pre-production, and R&D. That's where Andy's at. GMP, that's where I work in. That's like the clean room environment. You'll get to see it a little bit later on in the slide. So the quality control department, that's where I work under. And it just got split into two, and then now there's like one manager. So technically speaking, there's a microbiology department. We do some gram staining, EM, GDP, PEM, data entry, and this is under Odalie. She's like pretty much in charge of the microbiology section. And then there's the analytical side, assay, aliquoting, testing, qPCR, ddPCR, and like, you know, endotoxin. Some of that stuff that's more like Jonathan's section. And he's the QC manager now. He just got promoted. So there's also quality assurance. They just hired another person there as well. That's basically, you know, all the records, all the processes, and the and everything, all the rules and regulations that we follow, either if they're FDA approved or any other regulations that need to be approved. They're the ones that look it over. They're the ones that look over like our forms, and if there's any mistakes there, if there's any discrepancies, and if there's something that that they feel is like not out of the norm, then they'll come to us and talk to us. Yeah, so that's something that I really liked, is like you're consistently talking to other departments. And then there's the receiving in the warehouse. I worked there for a little bit from my first 3 months there. And there's also facilities. They just hired another person there, and he's doing really great. He actually has like a degree in, I think, microbiome, or like he actually has a 4-year, but he actually loves working with machines, and he loves, you know, doing something different every time. You know, he could actually jump into the lab and perform like what you guys perform. He actually came from something like what you did. And that's something that you guys should understand, like what is it that you want to do, what department you want to work in. And that's something you should look into. Then there's the admin, where they do a lot of packaging and shipping, and they're the ones that are pretty much gonna like help you onboard when you start working there. So quality control services that we do at Cedars, there's GMP quality control capabilities include comprehensive cell banking, character testing, identity, viability, composition, activity, sterility. I just got certified to do that on my own. Mycoplasma, endotoxin, I also got certified on my own there. I'm working on flow cytometry. I've done PCR at Thermo Fisher. I haven't done this yet. That's on my list to do. And there's a custom QC method in development validation. So everything that we do, like we all come together and we all try to see from different departments, what is it that, what are the needs from manufacturing, what are the needs from QC, and what are the needs from QA, and not just that, also admins, because it is a smaller department. We all really work together, so we all have to like make sure we maneuver and make the process a lot better and make it flow a lot easier. So you can thank this slide for Jonathan, honestly. This is something that also that I learned, like doing a lot of presentations. Jonathan decided for us to do presentations at Cedars. And as far as this is what I showed Drew and the director, Peter. I show them this almost every month or every bi-weekly, what I do. So like this is sort of what I'm gonna go into later on in the slide, which is QA and spec checking. I upload a lot of the specs. Like every item and every material has a certification most of the time, but not all the time, but like a lot of reagents, they need to be tested. They need to be up to their standard and up to our standard. And we also got to check for the quality. And then that's what we do. They document it and then we file it internally. And there's like inventory management. That's basically, understanding like the warehouse. There's routine EM where we autoclave, and we also autoclave paper. I don't know if you guys have done autoclaving paper before. It's like a little blue paper. No? Because when you take that autoclave paper, it goes into the clean room, and that's where we actually use that paper to fill out forms and actually have SOPs as well. I do PEM. I think you did that with Ivan, right? Doing the PEM when you got test each other with the plates. Did he bring the plates with you guys or no? Yeah, I do some of that stuff. I also work with the monthly PM. You're consistently checking the incubators, the centrifuge, and to see if they've been calibrated, VSC cleaning. I'm also training other people. That's something that I think helped me propel from an assistant to a tech, because I was technically training someone that was higher than me. And I knew the process, I knew everything from when I started, and I was still under probation. I was still under the 6 months, and I brought that up into the, my one-on-one with Jonathan. I was like, I'll train him, I'll do the best I can, but, I only been here like a certain amount of time, and he has more experience. He has a higher, Andrew had a higher title than me, but I want to get him to be as good, if not better than me. And if he sees something different, I'm open to making the process better. A lot of like surfaces, EM training, which is like surfaces is like when you take a Rodak contact media plate and then you just slightly touch the surface, and then you also like wipe it down, and when you're looking for microbes on the surface. Non-viable, that's the one that's like non-viable particles, that's like dust that's in the air. Use a machine for that. Viable, that's the stuff that's living organisms that's in the air. And I'll go into that a little bit later on. And I also do a lot of shipping and packaging. Currently that was at the time, I was doing like updating some documents, and instant GMP, that's the data entry system that we have there. And that's consistently changing, and they consistently always are on us to make sure that we're up to date on the procedures. And this is some of the more stuff that I've been doing also, in September. A lot of it does show up even more, because they want to make sure that you're still capable of like doing some of the routine work, which is like, checking the incubators for cleaning. I've done a decontamination cycle. Sometimes that's annual and biannual. That's some of the stuff that you should ask at your job. Like who does that? at Thermal, they had that for, I think, the engineers and facilities. So I'm basically doing what facilities and engineering did at Thermal here at Cedars. You know, we wear a lot of different hats. Over there at Cedars, there's a lot of holes, and you're expected to fill those holes. When you're working in a bigger company, like Thermo Fisher, over there you're there to like actually, they kind of like put you in a bucket. You've heard Jonathan what he said, like, you know, they want you to like really make sure you know one thing, and then they'll probably move you on to the next thing. This is where I got my endotoxin signed off. That's Mamadou. Hey, he's teaching me like sterility right there. And then that Dr. Aurora took that picture. She went for like a tour. This is some of the incubators that we use. This is also some of the media plates. That's something you always have to inspect. This is cracked, and sometimes they do come cracked. You should always inspect the work that you're doing, and that's something that I brought up in the meeting. And then this little thing right here, this is the non-viable. This is the stuff that checks if there's dust, and you put that through the BSC to make sure the BSC is working, and that has a certain acceptance criteria. And this funny little thing, this is a replacement of that. So this is what they gave us originally. And I fixed it into the meeting because for years, I don't know why people did not want to do this. All you had to do was screw this and it would like prop up correctly. This was very loose and very fidgety, and like sometimes it would fall over and it would take, look how much space it would take. This doesn't take up that much space. So all I had to do was just put a screw in it and then just be able to, you can actually use this. They wanted to like spend money and do everything and buy this. It was like, you don't have to spend money. Like I technically saved them money. But I mean, this is better, I will say that. And then this is when we went to, with Andrew and Ivan to get my flu shot. I got paid to do that. I took like 3 hours out of my time. I hope they didn't get upset, but it's only because I had to take the shuttle and I had to like, you know, there was a line. Day one, I went. So that's the only reason why. Oh yeah, and he's having like some Starbucks, because there's a Starbucks over there at Cedars. So this is some more of like what I was talking about with some quality control. And this is something that you can actually talk about with your, you know, whenever you get into like a pinch or anything like that, they ask you like, you know, the clean room contamination can arise from people. You are the dirtiest. You're the one that's probably touching something that you're not even touching. You're supposed to be touching. There's some areas that might be contaminated, and water is another one, because sometimes there's moisture in the air. The ventilation surfaces is 5%, and transport of items in and out of the areas, that's like 5%. There's a decontamination process that we do over there, but I'm not going to go too far into it. But you understand that like when you're going into these areas, everything has to be super clean, and you have to be dressed and move a certain way, because any sharp movements, any major movements can even, you know, like I said right here, you are the one that's probably going to contaminate the product or the medicine. Because how would you guys feel like it if your Robitussin was contaminated by another person? Because, you know, they weren't properly gowned. You have to think about that, you know? And this is the touch plates. This is what I was talking about with the surfaces. So these are the RODAC. This is what it means, replicate organism detection counting. It contains lichen and probiotic, 80% inactive disinfects. Inactivate disinfectants. This is something Odalie got mad at me about, because I forgot that those RODAC plates, they have a little coating on them that removes the disinfectants, and you're able actually to catch the microbes, which is pretty cool. You know, like even if you disinfect the area, this thing can still catch a microbe, which is pretty cool. And this is when you sample like the at Cedars, we sample the BSCs and ourselves. And this is the viable particulates. That's the settle plates that you use. You've done that, right? Did you put sugar in it like you guys did, or no? You guys still do that? No? Oh, wow. I guess you changed it, huh? Well, yeah, so like that, you let everything grow, and you put that into an incubator, and then that's where you try and see if there's any microbes in that clean room. Same thing, there's that machine that I showed you. I'm going to show it to you again a little bit later. That machine detects if there's any dust, because you don't want any dust or any contaminants in that room, or even in the workspace that you're working in. And these are some of the classifications. Here I cited the FDA. Everything that you do, even when you're working in SOPs, you have to cite something. And that's very important. Even when you start working, like, who taught you that? Where did this come from? Your knowledge is very, very important, and that's what you're going to be learning here in school. Like, these are some of the criterias for ISO 5s. And this is something that we check every day or not every day. Well, technically, because there is a machine that's the REASE system, there's a HEPA system, and we check that checks it itself, and then we also have our own internally where we use a machine which is the MET 100 machine, and it checks this at 0.5 micron and then 529 microns for non-viable air. So that's the amount of dust. And there's different levels. I think at thermal there was like 7 and 8, ISO 7, ISO 8. That's when you put on the hairnet. I don't know if you see, you've probably seen people wear the hairnets in the beginning. And then there's the ISO 5 where you have to gown up and you go through the process. You're wearing scrubs, and you gotta make sure that you are completely aseptic. And that's something that I learned here, and that's something that I carried over. And thank God, I haven't had any deviations for any contaminants or any cross contaminants. Other people have, but I won't say their names. So why do we perform environmental monitoring? Environmental monitoring identifies potential routes of contamination, allowing implementation of corrections before product contamination occurs. So when everything is proceduralized inside the GMP room, and the reason it's proceduralized because we want to see if the process is going well. And for EM, what we're doing is we want to make sure that the process is being done aseptically. And the only way we do that is for all the testing that we do in quality control. And that's something that I learned in the quality control class, and that's what drew me into it. And all that stuff that I learned, all the lectures, that carries over, and that speaks volume. And then when you're especially someone that's new, you're actually hungry for that kind of information. And that's something that, that drew me into the quality control department. So when you start working there, you gotta know, how well do you know your machines? How well do you know the machines that are here? You have the spectrophotometers here. You've done the pH, I think, here. Yeah, how well do you know? When was the last time it was calibrated? How often do they do an annual check on it? Same thing with all these machines. There's a class 1, class 2, class 3. When you're in there and you start asking a lot of questions in your interviews, you got to know which version you have. And, how long is the retention for those machines? I think that usually, we try to make sure, see if there's any contaminants, if anything is repairable. And if we try to keep it as long as possible, if not, we have to discard it. But most of the time, we always try to keep all these machines, and we always try to keep updating it. And there's always someone that comes in on site to do the calibrations and the monitoring of these machines. It's usually annually. Ours is coming up in December, where they kind of do a shutdown, and then I have to go in there in the data entry system and update everything. So this is another way of understanding how well you know your machines. You have to understand how these biosafety cabinets work a little bit, and understand where the airflow works, and you have to keep it clean. And that's something that's very important. How is your workspace, and how messy are you? A clean bench is very important. You got to make sure that you don't start spilling everything around. You got to have it like this, very well organized, and kind of like how you have your house. You want to keep your house clean when you have guests. It's the same thing. You want to keep this area clean, and not dirty like that, and have it all over the place, because that can have potential routes of contamination. And this is something that I did wrong once. I did not put the HEPA filter when I was, aspirating, and I got in trouble for that. But luckily, there wasn't anything. There wasn't anything that was I was using as far as medicine that was going into like a patient or anything like that. But I did get like a talk saying, you should be having a HEPA filter when you start, vacuuming, because a lot of that stuff has a vac. Does that one have a vacuum in there? Does it, or no? You guys work on that? On that BSc? It does? No, that's a class 1, isn't it?
I see only one line incident.
All right, see?
That is vacuum.
Yep, probably. So these are the other equipments that you use. This is what I use at Thermo Fisher: mini centrifuge, aspirator, the centrifuge, a desiccator, the rotator, ELISA dotting, heat sealer, ink printer. You have to like start writing everything down, because that's what GMP is all about. Making sure you're writing every little detail, when you use it, how long you used it, and are you using it properly. This is something that I did in pre-production, which I thought was really cool. This is the Hamilton machine, which is what this does is this actually does aliquots, and it does assay mixing, which was actually pretty cool. This thing gave me a headache. It's a labeling machine, and it consistently broke down. But as an operator, you have to be there and understand that how that thing works. And a lot of times, other people are doing different things, and you're going to be in this industry. If you're in the beginning part, you're going to be doing a lot of grunt work. That's basically what I did there, a lot of grunt work. And what these are like the Quant Studios. These amplify DNA, and I could talk a little bit more about that. But each little detail has a lot of science behind it, and you have to understand some of the science as well. So if something happens in there, you get yourself out of a pinch. And that's sort of the reason why you have so much education here. So if something happens, they're gonna ask you, what was the process, what happened, and you can actually understand, well, this happened because, there wasn't enough a solution, or the machine didn't read this properly, or, something happened, which later on I'll tell you a little story about something happened when I started using one of these. So there's some more lab equipment stuff. This is what we use at Cedars. We have a cryogenic tank. Andy works on this. We also use a balance, and I use this in the QC lab. This thing right here, this is something that manufacturing uses. I've read the SOP on that, and I've also read the manual, and all this stuff comes from the manual. Like, you can get this information online on a PDF somewhere, because there's always like a general PDF, and that's something that you guys should be looking into, like when you're in your interviews, like ask them what kind of machines they use, and if there's which most likely there will be, is there like a general manual that you can look into, and you can actually pull whatever it is that's important that you're going to be working on. And I actually wrote some SOPs, I forgot which one it was, for a specific manual. I think it was a water bath. And I did another incubator, a small one, a mini one. I wrote that one. And this helped me looking at other SOPs. And that's something that's very important, to make sure that understanding other SOPs will make you understand the SOP that you're working on. And there's a lot of cross-referencing. And this is one of the incubators that we use. The top one is the bacterial incubator. We have one, this is where we put the settle plates. So there's a 20 to 25 and a 30 to 35. And then this one is also the CO2 incubator. This is where we put some of the cells. This is one of the things that I do monthly is change the water. I put this here for a reason. The SOP is going to have all this information. Usually that's for facilities, but you're there to do certain tasks. For me, I was just there to change the water and to check the filter if it needed to be changed, and also clean the inside. And that's something that you do periodically. And this is the MTech machine. This is something that I showed you before, like the little settle plate. And this is the viable. So what this thing does, how we have it proceduralized over there. So there's a ISO 5, ISO 7, and an ISO 8. The ISO 5, I lit that inside the BSC for 10 minutes. And And it's doing it for like 1,000 liters per minute, hopefully. If Oli does not see this video, I hope she doesn't get mad at what I'm saying. Because I'm supposed to memorize it. Because when you're inside the GMP room, sometimes you have to understand, you have to memorize some of the procedures, and other times the procedure is going to be there, and other times like you don't even use a procedure at all. So it really depends on which department you're in. I know that's how it was at Thermo Fisher, where when I was in trade production, Armin always wanted the procedure right next to you. And whatever step you were, you had to flip the page. And then whoever you were talking to, which was your peers, which was like Ray or Mike, they would ask you, all right, what step are you on? 7.1C or even 8.5. That's what step I'm at right now. And sometimes even Armin would come in and I was like, okay, what step are you on right now? And what's next? And what brought you to that step? But when I was with Evelina, it was different. She only wanted the procedure, and yeah, you can work with it and just have it out. When I was in pre-production, they had it out, but at the same time, they wanted you to sort of memorize it. But like every once in a while, they would say like, okay, so where's your procedure? Do you have it next to you? And if you didn't have it next to you, you'd be in trouble. From what I heard, I think R&D doesn't really use procedures that much. I mean, they'll just sort of teach you it and they'll have it in the background. But it all depends on which department you want to be in and what draws you into it. I need the procedure next to me most of the time, but I was able to understand and work through it. And eventually, you know, on certain tasks, you will memorize it and you will get faster. You will understand little nuances. And that's something that I did when I was there. And this is the non-viable one. This is the updated version. We're trying to get this one as soon as possible. This is the older version. This is the one that it sucks up all the dust that's in the air and it reads it, and it has to follow certain criteria, and it's set up in a certain way where you make sure that everything is up to spec, and every ISO level has certain criteria. ISO 5 has certain criteria, ISO 7 has certain criteria, and ISO 8. And you have to be aware of that. And sometimes it may not even alarm, and you have to look at the receipt that comes out once it finishes testing the areas. So like for this one, it tests the BSC for 36 minutes. And there's prep time when you do this. You gotta clean the BSC, you gotta clean this, you have to install everything, you gotta set everything up. You know, just like understanding your phone, you know, like when you start using it. Like this little screen right here has some steps. And so does like, you know, using this tube, you gotta make sure that it's on correctly. Because I remember having it on incorrectly one time and it started like having all these weird numbers. I was like, uh-oh. You know, you have to be aware of what you're doing. And this, we're gonna have 2 of these pretty soon. Hopefully Dr. Aurora gets one of these, and I kind of want her to, because that's gonna help you understand what we do in QC, if this is something that you wanna do. I know manufacturing uses this as well, but they don't use it as much as we do at QC, because we use it in like for the rooms and the BSC itself. And I'm gonna have to start working, I actually have the manual for this in my email, and I have to start working on this SOP, and I have to write it, but I'm gonna base it off of this. So I actually have a baseline where I can look at when I'm writing this SOP. And that's something that I felt was like very helpful. And also like from writing from right here, writing the SOP here at Mission, really understood the process of like checklists and, you know, filling out forms and how important that is, and to proceduralize certain things. And what I love about this thing, hopefully we get it soon, this tests the BSC in 10 minutes as opposed to this testing it in 36 minutes, because it's a lot stronger and it's pulling it a lot quicker. So why did I teach you all this? Because it's honest work, and on top of that, like you have to work hard for what you're building. You know, like these are basically chores. You're doing the grunt work. You have to work hard for the stuff that you're building and the stuff that you're creating. do you want to come over and help us out with this? That's something that you got to do, because this is what happens when it's not maintained correctly, if it's not cleaned correctly. There's a lot of rotor failures. You got to check everything. That's why it's always check up to date in the Instant GMP, which is our data center system, and we always write down forms making sure that, like, yes, it is functioning correctly. Just like the pump, right? Is that pump still there? It's alive. Yeah? You remember what Maricela said one time? She was like, this pump has been well taken care of than my health. Did she say that? Yeah, exactly. That pump is like, what, 40 years old? Yeah, and is it going to break down? Are they going to get a new one? No? Exactly. That's what they want. That's what they want out of some of the machines. It works, so why replace it, Why start another process? Why get another machine and then, have other people like go into it, and then like they don't understand if something breaks down, Maricela and you know how to fix it. You know how to, when something goes wrong, you know what happens. But if it's something new and it's something you can't control and they don't understand, who's going to fix it? That's sort of what they want to do with some of those machines. And all those machines and everything and all those procedures, they all have like FDA and OSHA, and there's a lot of verification, a lot of regulatory compliance rules and guidelines, and you don't have to know some of this stuff, but you have to understand some of this stuff. Like U.S. Pharmacopoeia, that's something that Orly was like, in trying to instill in me and everything. And I'll get into that a little bit further. And this is something that is important to understand, that like most likely you're going to be touching a lot of reagents, a lot of chemicals, and you have to like be aware of where your hands are at all times. Try not to touch anything inappropriate, like your head or anything like that. Make sure that like you're always doing everything properly, being sanitized, and you're not bringing any food or drinks inside the classroom. So this is also something that you should understand. Like you can ask them this in the interview. Like, how do you take care of your waste? How do you take care of your decontamination stuff? This is how we this is how we take care of our cells, because like they always check the pH. You always got to bleach them, and then you wait for 30 minutes, and then you dump them in the sink. If you're not doing that, then you're doing a violation, and then these people will come and they'll test your pipes and make sure that everything is done correctly. And you don't want to be in trouble, and you don't want to be who's not been disposing our waste correctly. That's something that you actually understand, and that's something that the professor always said. Like, make sure like you're throwing the trash in the trash and the things that are in the red bin in the red bin correctly, right, Professor? Always. And this is some of the dangerous good stuff. This is something I learned at FedEx. This is what helped me also get into this industry, was like I understood that like I had to when I worked at Burbank Airport, I had to follow FAA regulations. And those FAA regulations, it came in like a pamphlet, and I had to check off, see if everything was done correctly and if it was packaged correctly. And then sometimes I would have to open it and see it if I suspected that something was packaged incorrectly. And I was able to handle a lot of explosives, flammable gas, flammable liquid, dangerous when wet, corrosive, radioactive stuff. We shipped a lot of stuff to like St. Jude, at least in my section, and infection substance and stuff that's toxic. You have to understand that this is, even when I was doing EMT a long time ago, my EMT teacher said, I was like, I like to tell people exactly what they're going to get themselves into, so it's not a surprise to them. I was like, because when she went out there into the real world, she did not know the stuff that she was going to be. Nobody told her she was going to deal with like all the crazy people in the world and everything, and how the general public is, and that's something like that I want to instill in you guys to understand. Like, maybe you're going to be handling some stuff that might be harmful to you or the patient. And we always try to make sure that the patient is, because we do a lot of clinical trials, we got to make sure that the patient care is our top priority. like, and this is something that I do, but no, this is more like what Ignacio from the Green Building does. He transports a lot of things that we're testing. What we do is I transport mainly human DNA, and it's got to be packaged in dry ice and everything a certain way, and it's got to be labeled a certain way, and it's basically like, you know, grunt work. And you have to make sure that everything you're doing is correctly done. Like, this is something that I think happened when you were working, Professor, at Cedars, the St. John Hopkins evacuation that they had. Do you remember that?
Yeah, absolutely. That was a nightmare. That was a nightmare.
Yeah, they had. I'm sure that Cedars and other hospitals and everywhere else, they had to like revise and actually like audit their own packaging.
Internal auditing.
Internal audits, yeah. Because it brought awareness, and that's something that I want to try to bring awareness to you guys. You know, because if you guys are working at Grifols, most likely you guys are gonna be working with blood, right? Or plasma, and plasma, yeah.
Never blood.
Oh, okay,
Plasma.
all right. So it's not all like serious. You all have some fun here. This is Joel. I know Dr. Aurora's very happy with this. This is a photo of our second clinical sample manufactured and shipped to a patient. That's Daniel, the specialist, and then that's Joel. He was in the beginning. I remember doing a one-on-one with him, helping him get into the CBC. And they're checking for damaged goods. They're verifying the quantity. They're verifying the order. They're verifying items received and purchased. Anything that's wrapped, packages, ships and supplies, and delivers and receives supplies to the patients and to Cedars. That's what's going out to the patient. And quality patient care is our priority. That's our motto there at Cedars. And that's what Joel is doing since he's the assistant. He's packaging everything up. And all Daniel does is make sure and verifies what he's doing. Like I said, in this industry, you're going to have someone that performs and someone that reviews and another person approves. And he's there to make sure Joel is doing a good job. And he was trained by him. And hopefully, if you guys work there, you're going to get trained by him as well. Or maybe Joel, because he's going to be probably moving up as well. And this is something that I did also at Thermo Fisher. This is where your verbal and nonverbal communications come in. You know, they did a lot of lambda antigen tray, tissue typing tray. This is what this is. This is what this is. Oh no, this is antigen. It's been 2 years. Forgive me. So you're going to have one tech dotting the antigen. The other one is going to be dotting the PBS. And then you're going to have a third tech inspect it. And you're always constantly inspecting it. So like you're going to be looking in these little wells just to make sure that these needles drop the right amount of solution or the antigen onto these wells. And then you pass it on to the next person and they do the same thing, but this is the PBS. And then that's what they got to check as well. And then the third one, they check that this isn't like what it looks like, but this is similar-ish. And then the QC person checks it, make sure that they take certain samples, and then they take certain samples like the beginning, the middle, and the end, and then they give it to QC to make sure that everything there is done correctly. And then we rotate it for a little while. And then after we rotate it, it goes inside. We rotate it from room temperature, and then we rotate it overnight into the deli. And then in day 2, we aspirate it, and then we put it into desiccator. And all this is going on. You're writing things down. You're following the procedure. And this is all in tray production, so the SOP is right there with you all the time. And this is some of the interview questions and something that you're probably going to be facing when you're there. Like the GDP and SOP, that's basically like instructions. Like you have instructions to do just like you have instructions in class. And your forms and recording data, that's like your booklet and your paper log. You're recording everything that's going on, that you're doing and that's performed, and how much you're using and what you're using. And then there's the digital data entry system, which everything that you recorded goes into like a computer system. You got to think of it like school. You know, Dr. Aurora gives you the instructions, you follow those instructions, you do the homework, and then you write down the homework, and then Dr. Aurora puts it on Canvas, and then you get your grade. Same thing, same process, you know? And then you have to write clearly. I just got a talk with my boss saying that some of them weren't, well, I wasn't writing clearly because I was writing too fast. So anybody tell me what this is? Is this a 2 or is this a 9 or 24 or percentage? What do you think it is? Your guess is as good as mine because it's not my writing. I found this on the internet. I found this on the internet. So writing legibly is very important. And do you use codes when you do writing documentation? Do you still use TDE and TXE or something in thermal, right, Diana? When you do the codes, when you write something wrong?
There's recording error, calculation error, late entry, but it's also shortened down to like LECERE, so it's also on YouTube, memorize all these codes.
Yeah. Some things you have to memorize. And it's proceduralized too. That's in a procedure somewhere. But at Cedars, they don't do that yet because we're not there yet. So they want you to write a sentence that's short and concise and to the point that someone from the street can understand what happened and what documentation was going on. I used to not like this. I didn't think I was going to end up using this because I remember taking chemistry class at Pierce, and they were on it with all the documentation, and I was like, I'm never going to use this. Well, I actually did. And also, this is something you can ask them. How do you document time? Is it military or time or 24? Or do you use 12-hour time? At thermal, you use 24. At Cedars, it's going to be a little bit more confusing because we write everything down military time, but in the data entry system, we use 12-hour time. So you have to be, remember that little thing in the beginning? How you have to have attention to detail? Here you go. It all comes back. So what do you do during the documentation? Like if there's a pen leak that happens, like something like that, can you read this from far away? Can you understand what this says? Is this a 6 or a 9? Is that a 2? Is that a 1? Or you don't know? How is an auditor going to tell you this? How is your boss going to understand what you're writing? So you have to cross, this is the correct way. You just cross it out and then you just write initial and date and put the correct one. You don't try to fix it. You don't try to maneuver it. Best thing to do is just cross it out. And I know it happens. I've seen it happen to QA. I've seen it happen to the boss. I've seen it happen to Drew. Don't sound like I said that. where he accidentally, your brain and your hand just does not connect sometimes. And then you're just writing something do I really have to cross this out? Yes, you do. Because the auditor is going to come in and they're going to look at that stuff. It wasn't documented, it didn't happen. That's our motto over there. If you didn't write it down, it didn't happen. If you didn't write down that you finished something, and the next day you say, "Did you finish the job?" I was like, "Did you write it down? Where's the data that you entered? Is it there? No. Did it happen? Probably not." So be aware that this does happen. People do forget to write down stuff because you're in there, you're working all the time, and sometimes you'll forget to write something down, and that's something that you should be aware of. And if there's some empty space, you just cross it out, do NA and sign and date. That's something that a lot of people sometimes don't do. There's certain reasons why I don't do it on the end when there's a comment section, because I want to make sure, my boss actually might need that space at the end when they're reviewing everything. But that's something that you're going to be doing, NAing some stuff and writing all the information, and make sure that you're recording the data correctly. And these are some of the forms. This is just some forms that I saw on the internet. Don't get scared. I'm just trying to let you be aware that some forms are not this scary. They're a lot easier to understand. Make sure that there's the procedures. They have a lot of cross-referencing forms, and try to fill out the form correctly. Does the form need to be pre-approved or verified by? Make sure that it's the up-to-date version. Just like the procedures get up-to-date, the forms sometimes get updated. Okay, so that's something that you need to make sure with your QA department or even QC. Who approves this form? Am I missing something that's new? You know, you got to ask these questions. And sometimes when you're up to date with the training, that's something that you're going to be aware of. And that's sort of the attention to detail that, you know, you had from the beginning. Correcting honest mistakes. Make sure if you make a mistake and it's honest, be like, you know what, I messed it up. It was all me. I can cross it out as quickly as possible, get it done, and let your manager know. And can you transcribe a form if it's not up to date? That's something I haven't done yet. They don't want to do this because it's sort of like a pain. From what I heard, I haven't seen it happen, but the performer has to be there, the manager has to be there, and so does QA have to be there to see you transcribing, and then they have to write a note saying that you used something that wasn't supposed to be used before, and you're writing it in the correct form, and they document everything. That form that you didn't use gets slapped on top of that. And this is some of the stuff that I do and manufacturing does. I don't think Andy does this. So there's some specifications, and these are like the test results. These are a certificate analysis sheet. This makes sure that the product was up to standard. They all have an acceptance criteria, and they all have to be acceptable, and they all have to follow a certain result. And here, as you can see, like there's endotoxin testing. They do in vitro bioassay. They do pH. You guys done pH, right? Yeah, right? So I'm sure somebody somewhere in a quality control or somewhere is doing a certificate analysis or writing it down, documenting it. And this is what I was talking about like as far as US Pharmacopoeia right here. They're using this method and they're using this test for this. This is in relation to that. You see this is the test that they're using, that's the code, and that's the code you can find on the internet. And that's what they're using. And then they have to make sure that that's the most up-to-date version and that your procedure is up to date. A lot of stuff, isn't it? Yeah. So, and you have to understand the specs, you have to understand the test, you have to know the material, what's the lot number, what's the difference between a lot number and a catalog number. So the catalog is basically saying like this is the number of this product, and lot number is this is the amount of batch. So think of it as like, you know, this is class, you know, like what is it, Biotech 2, Biotech 3 still? Biotech 3, and then this is the year, what, 2022? That's the lot number, that's what you would use. This is like the group of that students, that's the batch. That's the same thing for an item or a product or anything like that. And you have to check the expiration date all the time, because this does happen, and this almost happened one time, and I was able to catch it, and you have to make sure that some of the products and items that you use are not expired, because sometimes you take it out of the system and it's there, and you know, you guys check your refrigerator, right? Do you guys want to use, you know, expired food or no? The same thing, you want to use expired reagents in your experiments? No. So you got to have the attention to detail. Going back to that little video, remember? You guys got to check every little thing. So where do you get the COA? A lot of times you get it from the website, or you ask them. Some companies have different policies. Some of those policies, like you have to buy the item and then you get the COA. You can retrieve this. You can get this off the internet. Like all that stuff right there, you can get a COA for that. I don't know if you've done that yet, Professor, in your class. All those items right there, that's all those reagents. Yeah, those items right there, the bottles.
I used to do it. This time Dr. Brown taught the Biotech 2.
Oh, okay.
The only time I did not meet them till Biotech 3 started.
Okay. So it's something like that. That's something that you should that we do at Cedars, at least I do, and this is something that we do internally.
With all the classes, so it was a little different this time. That's why when you asked about things, things have changed, yes, a little bit. Because
Yeah.
Biotech 2 was done by Dr. Brown.
Yeah, that's something that you have to look into when you're looking into a program where are they doing the up-to-date version? Are they consistently changing? That's when you realize you have a really good professor. That's when you realize someone that cares. Because usually a lot of people, they'll just do it for a paycheck. Be like, oh, I don't want to learn something new, forget it, I don't want to do that. You know, I was like, I'm still getting paid either way. But Dr. Aurora actually cares. She wants you to be prepared. That's why all these companies are looking for you. That's why you have to give it your all. And that's sort of something here. You have to give it your all when you're looking into these documentations. There's a lot of documentation that happens, especially in QC and even more so in QA, because that's the final approval. That person who's in QA has to make sure that the reviewer and the performer did a really good job. And if that's something that you want to do or look into or go into that industry or that department. So this is a data entry process, you know, like this is something that I found on the internet. Like this is, you know, you register the item, you prepare the item, you work along in there, you test it, you validate it. Sometimes you need to retest if something happens, or, you know, if there's another batch, you retest it again, and then you see if you approve it. There's a C of A, right? And I just go over that with you guys. See, and then you report it, and then that's where it goes into like the QA, and then you store the data. All this goes into it, and I just explained pretty much everything right there for you guys. And that's something that we do at Cedars, and that's something that they do at Thermo, and I'm sure that's something that they do in all the other departments, in all the other industries, and that's something that you're going to look into and like which department you want to work into. You want to manufacture? Do you want to review? Do you want to approve? Or do you want to just, you know, run and manage it, or, you know, come up with a different method? You know, always consistently working, always constantly understanding the data entry system and what data entry system the place you're going to, or even at Cedars, what they use. Because they probably use this system. This is the Laboratory Information Management System. This is exactly, see what she's doing? She's got to scan the item, and it goes into a data entry system. A lot of times she's trending the data, as you can see. That's something that I do, I trend the data. And that's something that I did in QC class and when I was working with Excel. Remember, Professor? Yeah, that's something that I enjoy doing. At Thermo Fisher, they have SAP and Master Control. At Cedars, they have Instant GMP, and LabVantage is what we're going to start doing. So hopefully, if some of you guys are like interested in coming in here, you'll actually understand what kind of data entry system and have a leg up on what it is that they do, and like little like nuances of like how to use that program. So this is what you can use in your interviews. This is the STAR technique. I don't know, there's a bunch of different techniques out there. This is what works for me. This is what worked for Diana, right? You use this, and a lot of other students love this. So what is the STAR technique? Well, if you guys have been paying attention, I already gave it to you. You describe a situation or event you're in. There's a task, and an action, and a result. So you actually, this is what really helps. Like when they ask you something, like what is it that you learn, what is it that you're bringing, you can just give them an example, and you can use this technique, like a situation that you were in, a task, something that happened, and an action, like what were you doing, and what was the result? Did you learn something? Did something go wrong? Did you help out other people? Like, did you like come into a meeting afterwards and discuss what happened? That's what the STAR technique is, really helps. And in the interview, like they're gonna ask you like, this is something that you should flip the interview. If they ask you a question, dig into it. Ask them, why are you asking me that question? You know, I was in an interview one time and they kept bringing up like recalls, and I've never been in a recall. And I was like, can you tell me more about that? What happened in that? What was the process? Was it a failure in like, in the manual? Was it a failure in like the automation process? Was there a simple mistake? You know, like, ask these questions: who, what, where, and why. You know, what is that? How does that work? Why is that sequence? Why is it in that sequence? And another way to like, when you're in those interviews to understand this is like, understand like when you're reading those SOPs, they're basically telling you something. And what does this page tell you exactly? Like, what do you think? Is there like a word or a theme you guys can think of when you're reading this? Like what when you see these questions, what are you thinking about?
Are you interested in the work?
Interested? That's cool. Anything else? I like that. It's the first time I heard that. What feeling, what attitude do you feel like asking these questions in an interview is a person that's giving the interview is going to be receiving? Okay. What else? All right. Anything else? No? So you're really trying to learn? Close. When I wrote this and when I was in there, curiosity. Curiosity is what made me like, if how curious you are, how open you are to like understand is like what you are in the interview. And not just in the interview, but like when you're working a procedure or a process or even a protocol, be curious about it. You're like, what happens if this happens? What happens if that happens? You know, which direction? Why are you doing it this way? You know, what is that? How does this work? You have to understand what that is. So being curious in an interview or even in the procedure or the experiment really speaks volume of who you are and how well you're going to be able to understand the process.
Tell them what is the significance of asking questions. I told them the story of Krebs, Joseph Krebs. I have not been able to get that fire out of them getting questions. Few people get the conversation. You were one of those people who would always ask me questions. Asking questions, asking good questions, that's what is, I think, most relevant thing for growth, for entry, for anything.
Yeah, asking questions is really important because it shows that you're engaged. It shows that you're interested. My favorite thing to ask also, like, I was like, because you guys are beginners, you should ask them, what are the mistakes that beginners make that you see that you wish they didn't make? See, that makes you curious. You know what I mean? And another thing is like here, when you're in it, you got to learn how to interview also. Not just interview, but like when you're doing that process, you're basically interviewing them. Like, how is this process being done? You know, like, I'm going to give you a test right now. How about this? Ask me a question. I'm going to give you a question. Ask me what I like about school. Go ahead. Go ahead.
What do you like about school, man?
Lunch.
What part of lunch is?
The food. Okay, now ask me that question again.
What do you like about school?
Well, I really like lunch is because it starts at a certain time, and then once I go into lunch, sometimes they have Taco Tuesdays, and when they have Taco Tuesdays, I have the option to have either, you know, a fish, chicken, or even steak. I wish what they would do is like combine all three of them and have them all at once, but they don't do that. Some people like to add sauce in it, but like I don't like to add sauce in all that stuff. You see how that's more interesting? Instead of just saying lunch. You see how that goes? Same thing with the process. I was like, how do you like this process? It's cool. So this slide right here, you should thank Odalie for this, because this is what she gave me advice when I finished my probation. And I was like, what makes you last in this industry? And I was like, she told me what makes me last in this industry. I was like, can you pick up the workload quickly? Are you not being bored at work? And attention to detail? And are you creating SMART goals? And we can get into that a little bit. This is what you need. This is what she told me, and this is a gift that I'm giving to you guys. You know, huh? I know, right? Ah, see? That's the little trick I did. Right? Someone caught it. Cool. Another thing I wanted to catch was like, do you see this? What do you see in here? This is some of the trays. These are the 380 well trays that you use at pre-production. Did you see that, Diana? Did you ever work on this? Oh, you didn't work on them. Oh, so you saw this, right? So do you see something here? What do you see there? Or how about you guys? What do you see there? I know it's kind of probably because of the projection you don't see, but. Do you see if it's filled or not? You can't tell? That's one of the things that you have to know, like when you're looking into those things, how can you tell if something's filled correctly? And you gotta look at every single well. And not only that, I'll tell you a little story. You see this right here? I don't know if you can barely see it. There's a line there. Do you see that line? Barely or no? Some in the front probably can see it. It's sealed. They put a sealer on it. They gave me one for the very first time without a seal, and they didn't tell me and I put it into the PCR machine, and it melted. This tray thing melted. And that was not my fault because I was brand new. I was still being trained. So whose fault for attention to detail was that? Was it the person that was training me? Who else? Was it the person that was giving it to me also?
Someone reviewed
Yeah,
the whole team.
the whole team, right? Exactly. Being able to work with others is very important. You know, don't just hand off work to other people. Make sure, remember, like, this is what happened, and it scared me. Like, I was like, did I do something wrong? I'm gonna get fired. No, I was like, no, they just didn't give you a sealer, and it melted the tray. So this is some SMART goals, right here. This is something that you know that Cedars likes to bring up all the time. This is something that you should learn internally, you know, by yourself. You know, like when you're doing something, is it specific? Is it measurable? Is it achievable? Is it relevant? Is it timely? You know, what do you want to achieve? You know, especially in your life. You know, who needs to be involved to accomplish this goal? Like, who's going to train you? Like, where are you going to look? Like, if you want to work in Cedars, if you want to work at Thermo Fisher, like, who's going to help you accomplish getting there? That's something, the same thing when you're working a process or a procedure. What's going to help you get there? You know, how do you measure it? Like, is there a certain like learning curve? Everybody has different learning curves. My learning curve is different than your learning curve, you know? And how do you gauge that? You know, that's something that's, you know, a little bit anecdotal, but is it achievable? And is it relevant? Does this help the business? And can you do it in a timely manner? Also, what makes you last in this industry? What are your certifications? You know, Dr. Rohrer gave you those certifications, and the way this program is set up is for you to actually get a job right away. You know, you can get from certifications to a degree, and if from a degree, you actually want to pursue other degrees or get other certifications. So I'm here to tell you at Cedars, I use a lot of Word, Excel, PowerPoint, and Outlook, which is like emails. If you want to work there, that's something that you're going to be using most of the time, and I suggest you guys, you know, really learn really well. And there's certifications that Microsoft has online, and you should actually get some of those. And I think it's kind of important, and it's going to make everything feel a lot better, and you actually might make the process better. And that actually can be attributed to your SMART goal. And also, like, these are like some of the Six Sigma, which is like Lean Six Sigma, which is like making sure that every item and everything is done correctly and you have the right amount. And there's different levels as well. This can help you, like, start now, like learn this stuff now. Even like QuickBooks, you might want to do that if you want to move into that. See, ask them if you're going to be in a startup as well. Maybe they need somebody to learn QuickBooks. OSHA certification, that's hard, but still that's achievable. You know, how does anybody want to like have a safety person there? Like, why not have more than one? If you guys get other certifications, that's going to put you above somebody else, you know, if that's something that you're looking into. So what else makes you last in this industry? Performance reviews. You guys seen this, right? You guys still have these report cards?
Yeah.
Does it look familiar? You guys are getting PTSD?
Yes.
Yeah? I know I did. This isn't mine. I found this on the internet. So those aren't my grades, professor. Yeah, they do have report cards in this industry, pretty much. But this is like they do a self-assessment, you know? All that stuff when you feel like you're like, oh man, I don't need to have English and all this writing. Well, guess what? When you go in there, you're gonna have to write your own reports, and you have to evaluate yourself. And you be honest. And I'm gonna tell you a little secret too. When you're there, they already know. They wanna know if you know. They wanna know where your weaknesses are. They wanna know where you're gonna lead yourself into, you know? And that's sort of the same thing. Like, you may be a good at, you know, getting good performances, but is everything else, like, are you going beyond the expectation? Are you exceeding the performance? Are you meeting the standards, or are you underperforming? This is where you don't want to be, underperforming, you know? And a performance evaluation is a formal check-in to process used to evaluate the team members based on their past work
and to give feedback for future success, because they really want you to succeed. They really want you to see if you're learning. They want to see if you're going on an upward trend and not like stagnant. Time management courses. This is something definitely that you should probably look into, or even like understand that like there's only 168 hours in a week. So make sure you use your time wisely. You know, once you start working, you're gonna be working 40 hours. And then your sleep should be like around 49. And then look, this is LA. So like travel is like, what, how many hours again? 7? It's probably more here. So if you think about it, that's 100 of your hours pretty much gone. What are you doing for the rest of your time? That's what they want to know. Are you going to be learning? Do you want to stay here? Are you studying? So there's a difference between spending time and investing time. So where are you investing your time off work? You know what I mean? So lab etiquette is something that's very important. You know, what is your attitude in class and at work? Don't go into this profession with a bad attitude saying you don't want to do this. You know, create small talk. It all starts with attitude. Trust me. This is something I learned at Amazon, where like they check in on you to see if you're on TOT. What is TOT? Time off task. And always when there's like downtime is equal to cleaning time or GDP, or making sure all the documentation is done correctly. Make sure you're always working, always doing something. If they see you like not messing around or like not caring, you're gonna notice. You're gonna know like what is this person doing? You know, they're gonna get a feel of what you're going through. And the reason I put these bags, I don't know have you guys seen these bags out there in the street before or no? You haven't? The reason I put these bags is because in Amazon, what they do is they scan these in these bags, like the packages, and they scan a little barcode. They scan the package and they scan the barcode and they put the package in there. And then the driver scans this thing and then takes it and puts it in there. And then once all those shelves and everything is filled up and all the trucks have taken it, the warehouse is technically empty, you have to put these bags back on there. Guess what everybody didn't want to do at Amazon? They didn't want to put the bags on there. They got lazy. You know, they didn't feel like, no, it's too easy. I don't feel like doing that. Oh, I don't feel like, I'm still getting paid either way. So that's sort of the same attitude that you don't want in this industry. Don't go in there thinking, I'm getting paid either way, it doesn't matter. No, you want to make sure that when you get to that performance review, that were consistently working and you were helping others, and did you learn anything? So what are the work habits? You know, in the beginning, like most of you guys probably, you know, are doing a lot of entry-level work and it's grunt work. So you're starting from the bottom, but there's an advantage to that because then you get to understand multiple jobs and multiple procedures, and you have to look for the top performer at your job. Like, who is your top performer at your department? I mean, I know for me, when I was at Thermo Fisher, Ray was a top performer. He was there for 35 years. And he knew everything. He knew exactly what to say. He's been doing it for so many years. He knows what to do. So they wanted every other person to be like him. And in filling, it was Tran and Maricela and Lonnie, right? They were the ones teaching Diana. You know, like they were the ones teaching me. And if you go to pre-production over there, it was always like Haneen and Jamie. And those were the names I always kept hearing over and over and over again. And then that's something that you're always going to hear in that industry as well, in certain departments. You know, who is your top performer? Why are they the top performer? Where did they get their education? And what are their nuances? And what can they teach you? You know, they want you to be a clone of that person. And maybe you might even see something, help them out, learn something new that they didn't see before. And adaptability over knowledge sometimes. Depending on what you're doing, your ability to adapt is very important, because sometimes people go into this industry, be like, oh, I learned it a certain way. I don't want to do it that way. Well, we're doing it this way. And then I was like, no, that's not how I did it, how I learned it before. Some people don't want to adapt. You have to learn how to adapt. You have to learn how to work with others. And you have to understand that that's very important. And the basics get you the position. The changes you learn in the position will make you last. And this is something that I learned at Amazon, which is 5S. Sort, sustain, standardize, shine, and set in order. That's something that it's basically saying, you know, is everything clean? Is everything in order? Is everything up to date? Is everything, do we have everything ready so we can start our process, so we can start an experiment? You know, Six Sigma is right here. I talked about this before. Recognize, define, measure, analyze, improve, and control. There's a bunch of different work habits that have different acronyms. These are the ones that they ask for in Thermo Fisher. And there's another one here I want to talk about, which is Teamwoods. I know you heard this one, right, Diana? Yeah. But there's something special about this one that Thermo Fisher was sneaky about. They only gave TIMWOOD. They skipped the S. Now, I want you guys to read this and tell me why they skipped the S. I know Diana knows why, but I want to see if you guys know why.
Skip the S because you probably should already know that, no? Or there's something that you have to learn on the job.
That's one way, sure. What else?
I don't know, something you learn.
Something you learn? Underutilizing people's skills and talents and capabilities. Why did they take that off?
They don't know yet.
Someone has to do it. Even if it doesn't necessarily require a great skill, but somebody has to do it.
Exactly. That's one of those things, like, they want you to do the job, but like once you know it pretty well, like it was like, uh-oh, like they might be putting you in a bucket, just like, remember that's what Jonathan said? They want to keep you to do that job. They want to make sure that like you don't want to leave and you're stuck in that position and stuff like that. You have to be aware of that. You have to be aware of your own skills. That's something that I told you in the beginning. You know, like every one of these people can like be as good, even better than me. So you have to understand where your positives are and exploit it and let them know, you know, and let them utilize you. Make sure that, like, you know, if you know something very well, that it's being noted. You know, Ivan knows how to do computers very well. He comes from a computer science background. So he utilizes that skill very well. You know what I mean? So everybody can bring something different and you have to understand what is it that you have to bring to that company. So this is CAPA. This is what we use at Cedars. So it's corrective action, preventative action. And I know what this is. You've seen this, Diana? They still use this or no?
Yes.
Oh, they still do. Oh, wow. This is something that I did in Thermo Fisher. So these are little boxes, and they put little vials in there. And then this is what we did for C-Core, right? Ha, I still remember. So C-Core, so people would write the letters and numbers, and it would be time consuming. And remember how we did in the beginning, how GDP, how sometimes your brain or sometimes people like wouldn't write it correctly, and you'd be like, what is this? So I decided to create label stickers to avoid mislabeling and illegible writing. That's a CAPA. So I'm correcting a mistake. All I'm doing is slapping a label on there. And before, people would write it on there and make mistakes or be illegible. But now, like, I've corrected that, and that was part of my CAPA. That was a corrective action and preventative. That's some of the stuff, that's the mentality that Dr. Ora kind of like instilled in me, and also that I learned from Amazon, and I learned in Thermo Fisher, and I'm continuing that at Cedars. You know, how am I making this process better? Does this make the process better, just slapping a little label on it instead of writing it? What do you guys think? Can you read and understand all this? Yeah. Would you prefer just slapping a sticker on there, or you want to like write hundreds of boxes? How many boxes did you write, Mariana? Or sticker?
The most, like 36 orders, so you're spending quite a bit of time writing it out, so it'll be up to like 20, 40, maybe 100 boxes you're doing.
Exactly. There you go. Is that same time? Is that part of like Teamwoods? Transport, motion, overproduction, waiting, inventory, overprocessing? Isn't that the same? Set, sort, sign, standardize? Did I standardize that? Did you recognize? Did you define Did you measure? Did you analyze, improve? Did I improve that?
Standardized it.
Yeah. Is that correct? And they still use it. I should have got paid extra. So when you go in there, lab etiquette is very important. Don't go in there saying, this is not my job, why am I doing this? Say you want to understand this. You have to understand why you're doing this. Sometimes, I mean, this is true, like, there's going to be toxic team members, and there's going to be people that, you know, bring a sort of negativity sometimes, and it is reality. You know, sometimes people get tired. You know, sometimes people have anxiety, you have stress, you're dealing with depression, you know, and there's a lot of stuff that's going on in the real world, and you have to, like, work around that. You have to understand yourself and others, and, you know, really understand that people are people, and that you don't want to go in there not saying like, oh, why am I doing this? This is too easy, or I don't feel like doing this, or oh, whatever. I'm just here for a paycheck. Because Dr. Aurora is not like that, and you shouldn't be like that, and I'm not like that. And I guarantee you, all those other people that were working there, like you saw, like they all like working there. You saw the meeting. I was glad to have my QC team help me and come in there and be a part of that meeting that we had in the Q&A that we had at Cedars. And then they left, and then Andy came in because they were busy. You know, they all want to work with people that actually enjoy the work. They enjoy the work. And that's something that I ask in the interviews as well, especially at the end. Like, my favorite thing to ask is like, what makes you get up in the morning? What makes you go to work? You know, like, why are you here type of thing? You know, that's something that you should be thinking about when you're in those positions, and especially entry level. And then moving on up to a different department or whatever section you want to feel like going. The lab etiquette, you know, these are like some articles that you should like really look into, like 14 bad habits that can cost you your job, you know, like understanding like your coworkers and understanding the fact that, you know, there's introverted people, extroverted people, and like ambivert. I am an ambivert, you know what I mean? So like you have to understand that like just because I'm up here and I'm talking to you doing the presentation doesn't mean I'm extroverted. I'm actually like in between. There's days where like I'm very introverted and I'm just like in my zone listening to music, and people are like, why are you so quiet? I was like, I don't know. Sometimes I just feel like working, you know? There's nothing to talk about. You know, people have weathers, and it's just like, this is something that Maricela told me about, like, Gunn asked other people to see if they were like mean or rude before casting. That's sort of the same thing that happens. When I was moving into pre-production, what they do is they ask the other departments come into the department that you're working in, and then they ask them, how is this person? Can this person work well with others? And does this person actually produce work? You know what I mean? That's a industry secret that I'm telling you guys, and that's what she told me. Some people did not listen, and they were there for like 3 years or 4 years in the same position, more educated than me, more experienced than me, and they were still like an operator. Why? Because they didn't know how to work well with others, and they were a disaster to work with, and on top of that, like, they were just distracting. And you have to understand that being a distraction is real, and it could be like whether you're trying to be funny or maybe if you're just like not understanding the process, but working well with others is important. You know, being a team player, that's basically what I'm trying to say, is like, are you coachable? Like, does anybody know what coachability is?
Are you teachable?
Yeah, are you teachable? Exactly. Are you teachable? What else?
You have to have potential.
Potential. That's good. I like that. Do you listen? Exactly. Some people don't listen, and that is a fact. There's people there that, like, I have the text where a certain someone was in, Dan already knows what I'm talking about, but a certain someone was in one department. They moved that person to another department and was being difficult, and then they just let her go. More education, same age as me, more experience, and they let that person go. And that's sad. And that's what I don't want from you guys. And this is my warning. And they warned that person. She tells them, I was like, hey, they look at you and they try to see like, can you work well with others? I'm gonna tell you another little secret. When you're at Cedars, they're gonna put you in the packaging department most of the time. And then they're gonna put you there to see how well you work with others. And are you teachable? And can you sweat the small stuff? Because if you can sweat the small stuff, you can sweat the big stuff. It's a little training course that they run through you. And they did it at Amazon as well. That's where I learned from it. And then they continued it on in Thermo Fisher, and I bet you they still do it in other departments and other places. First they'll give you a little talk, and then they'll like make sure that they'll see if like there's something wrong with you, or if something wrong with the process, and then they'll put you through a boot camp. And then after the boot camp, if you're still being difficult or not being like just distracting in any other way, like then most likely you're gonna be let go. Do you want to work with difficult people? Or no? No, right? You could be smart and have all the knowledge, but if you're not coachable, teachable, being able to adapt, adaptability doesn't just mean teaching you the basics and, being able to adapt and accepting their methods. It's also accepting their methods and being well accepted within your coworkers and your classmates. And this is some of the pillars of trust, because without trust, you'll probably won't be able to do a lot of those machines or work on there. Andy is one of the most youngest people in our department, and they trust him to run all that stuff. Straight out of college, out of high school, I've seen people like, even when I was working at Amazon or Thermo Fisher, or even FedEx, I've seen people where they're really good, they're really smart. But as soon as you lost that trust, man, you're not going to advance. It's hard to get it back. Make sure you maintain all this. Being honest, honor your commitments. Admit when you're wrong. There's someone I know who I work with, when they nameless, does not admit when they're wrong, and that's kind of like a fault. But not saying not everybody's perfect, but they do have, they do communicate effectively, and they are vulnerable. Person's very helpful, and they're transparent. They stand up for what's right. But I know someone that does not have this, and I'm sure you guys got to look into yourselves and figure out which one of these you probably need to work on yourself.
Could you explain this vulnerability?
Vulnerability? Vulnerability would probably be like you're nervous, you're scared of like doing a process, or you're not quite sure. There's some weakness in like a process that you're doing. Being able to like express yourself and your feelings about like, are you sure you want me to do this type of thing? Because I remember going into a process and be like, are you sure you want me to do this? Because I've never done this before. Same thing like when I was training somebody, I was like, I mean, I'll do it, but I've never trained someone that was above me. I just learned this, and you want me to teach someone right now? Okay, I'll do it. Like how comfortable are you? And a lot of times you can ask them in the interviews, or even when you're working, is like how much of the work is formal and informal. You guys know what that is? When something's formal or informal?
Yeah. It's like the record kind of thing, getting their opinion, more structural.
Exactly. So formal is like got signed off. You went through A, B, and C. Okay, now you can do A, B, C, D. Okay, now you did A, B, C, D. Now you can do A, B, C, D, F. And then you go through all the alphabets and you go, okay, now you're signed off. You could do the whole thing on your own. Now teach somebody and everything. And then informal would be like, I need this task done. I've only done it once. Doesn't matter. Here it is. It needs to be done by the end of the day. But I don't know how to do it. I was like, you already did it once? Figure it out. But I need help. I was like, go get the help you need. Can I write it down? Do whatever you need. It doesn't matter. Write it down. Do you have notes? Did you write it down? Well, write it down this time. That way you know how to do it. That's informal. You know what I mean? Some of it might be more informal. So this is Dr. Aurora's favorite slide. And this is something that I was trying to explain before without this. And this is something that, like, she took a picture of this last time. And I'm glad that she did this because this is something that a lot of people don't teach. And unless it's something that Sarab, I don't know if you've met him, he was like kind of quiet on my presentation before, but he really became vocal when this came around. And this is something that I hope you guys become more vocal as well too. Where like, you can get the most trustworthy, I mean, you can have people that can perform really well. These are your A students. These are straight A's, high achieving, high performance, but do you trust them? Are they doing the job really well? Are they documenting everything correctly? Are you sure that they're doing it correctly? Because if they're by themselves, do you trust this person doing this job? You know what I mean? So these are your grades. A lot of the system right here, when you go to school, they judge you on this. But this is different. I like to think of myself as in between here-ish. But like when you first start out, they're going to think of you right here. Low performing, low trust. And then over time through your probationary period, they want to see if you go through here. And it's okay if you're here, it's okay if you're there. Because guess what? What if I'm right here when I first start, and then the top performer's right here, and then there's another person that's over here, and there's another person, and we're all working on a task. If you add us all up together, we're over here. Am I right? But then if there's somebody that, you know, can perform it really well, and you don't trust that person, do you want that person in your team?
Do you? Is that person being honest? You know they could do the job, but do you trust that person? See what I'm saying? Exactly. This is what I'm trying to tell you guys. It's not the abilities that make you who you are. It's kind of like the choices you make you propel and excel in this industry. See what I mean about that? And this is very, very true. Because I just gave you that example, right? About that other girl? She had all the experience but could not work well with others. Did they trust her? I'm sure she could perform really well, right? And there's a bunch of people that are like that sometimes. It's sad. But this is why, like, you can apply this anywhere. This is my gift to you. If you guys are not interested in this industry, you know, like, you could apply this in anything. Is there anything you can think about that you can apply this to? Your partner? Yeah, exactly. Because you're going to be working with these people. You're going to be spending the most time with these people. I remember, this is a story I'm going to tell you guys. I remember one time I was sitting by myself. I won't say where I was sitting, but I was sitting by myself having my lunch. These two managers came walking by. And then they were talking about something like this, where they said, well, one of the managers was talking to the other manager and says, you know what? I really don't care if I love you or I hate you. I just want to make sure that you can do the job really well and that you're at that threshold where I like you enough that I can deal with you throughout the rest of the day and you can perform really well. Because if I don't trust you, you start annoying or distracting, because at the end of the day, it's a business. I'm trying to run a business here. I don't care if like this person gets it in 1 month, 1 week, or even like 10 weeks. Eventually, the more you work at it, the more you work, the more you do it, the more you perform, you will get better at it. Over time, your performance will go up, but your character
Do you have the strength of character to be trusted? And that's something that you're like, why Dr. Aurora pairs you up. That's why Dr. Aurora is like here and you're working with others. And it ties back to the beginning of the very first slide, where like 70% of it is what? Do you guys remember? On the job experience with who? With your teammates. Exactly. Because you're going to learn from them and they're going to learn from you. And that's facts. And this is another slide everybody loved, because at the center of all this is going to be you on LinkedIn, and you don't know which department or which section you're going to go at. I mean, when I first came in here, I had very low expectations. I was like, oh, you know, I'll just go to Leaf Labs. You know, have you guys met the guy from Leaf Labs or anything? Yeah, so I thought I was going to go there. This is in Valencia. And I did my project on this company. I was ready to go. I was filling out the forms. I was trying to get the interview. Didn't get it. I got interviewed by Grifols. I got interviewed by Takeda. I got interviewed by Quest, Thermo Fisher. You know, and once you start putting your resume and you start getting a lot of experience, and you start doing all the grunt work, and then you start paying your dues, then you start moving into. Then they're going to start noticing, and other people are going to. And then you have to understand which company you're going to want to work for and which department you want to work for, because there's a lot of these companies are there for you, and you got to be there for them. Be there for them. You got to make sure you have the skills that you're learning here that in this class is going to transfer into one of these companies, and they're going to want that. And that's what happened, because when I was at Thermo Fisher, and I just kept explaining what I did at Thermo Fisher, you know, all the stuff about continuous improvement, working with my teammates, understanding the process, understanding SOPs, writing the forms, you know, learning it quickly, not being bored at work. All that stuff was very important in my interview. And this is very important for everybody to actually go in now and start doing that. Cedars is very big on LinkedIn learning. They actually have a little program. I don't know if do you guys have LinkedIn or no? No? You better start now. Because all those all the stuff that you sign off on with your, or that you write in your resume, like Word or anything like that, there's many certifications that LinkedIn has. And if you do those certifications in LinkedIn, and then a company sees, hey, this person, you know, completed some of these tasks, and they have certain years of experience, and they have a degree, maybe we should hire them and call them.
Out of curiosity, are those the same ones that you find on Indeed, where you take these like assessments, and then it's like it's not part of your resume, but part of your profile?
Yeah, like LinkedIn Learning. That's what you're talking about?
I'm guessing that something similar, because I haven't done the full LinkedIn project. I made an account, but that's it. And so I haven't ventured into that. So when you said like, oh, there's these kind of like assessments, like these exams, 10, 15 minutes.
Oh, so that's an that's an assessment test for the interview. I've taken those, but with LinkedIn, like they have it's kind of like YouTube videos, and then there's like a little exercises that they have, and sometimes you could download some of those exercises, and then those are little like certifications, and there's like little small little workshops that they have on there, and that's something that Cedars was actually pushing. Why do you think they're pushing for that? Why do you think, if LinkedIn is a place where you can find jobs and connect with other people, why do you think Cedars is pushing for people to go on LinkedIn Learning and learn as much as they can?
Because I want to make sure that they have the proper skills developed before they go into the job, like at least know what they're doing.
Yeah, okay.
It also shows that you're really interested.
Okay, what else?
Establish credibility.
Credibility. That's a good one. What else?
Probably free, no?
I think so. I mean, it's free for Cedars, but you could check it out. Yeah, I would definitely go into that. I mean, I'm on there. Like, all my bosses are on there. Like, Raquel just added me, you know.
What you're doing with your time.
Yeah, what you're doing with your time? Oh, for LinkedIn Learning?
Like for example, LinkedIn, you have to invest in it and do all those processes, but it's like when you ask them the question, what do you do on your free time? But if they see on LinkedIn all of these things that you're doing,
Yeah.
it's like you're
Time management courses. Remember that whole thing? Exactly.
Yeah.
Another thing, it's a little secret that I'm going to tell you guys. I'm telling too much secrets. If you're a good worker, remember what I said about this? I mean, you can perform it. And then they'll say like, okay, so this person, is this person coachable? Do we like working with this person enough? Do we trust that person? So that's a place where you can like look for other jobs. So the most likely, they want to keep the people who they want to keep. They want to keep the people that are valuable. They want to keep the people that work really well with others. They want to keep the people that perform really well as well. That's why they were good. They're pushing for that because they want to make sure, you know, they'll give you that high compensation for when you start getting calls from other companies as well. And also like to understand like what the market is going. Because you're going to want the market to drive your compensation, not just your experience. And then over time, I probably shouldn't say this. You want to take the opportunity over loyalty over time. You know what I mean? I mean, first you start out for loyalty, and then you can after a while, like, you know what? There might be other opportunities, and you're not going to know if you're not connected to other people. Stay connected with each other. You know, like you saw Diana, she's connected to me, and then like same thing with like Ivan, he's here. Andy, and even like my boss, you heard him, like he didn't want me being on LinkedIn. Is that true or no? Exactly. Exactly. So in conclusion, you have communication skills. Are you honest? Can you improve your skills from the basics? Your work ethic, are you on time? Are you dressed to impress? Your flexibility, like are your ability to adapt to the changes? You know, if there's something happens, oh, we have to start earlier. Why? The process changed. Oh, we have to start later. Oh, can you come in a little bit sooner? You know, you got to adapt to them and they're going to adapt to you. They're going to be flexible to you and you got to be flexible for them. Determination and persistence. I'll do it. You know what? I'll give it a shot. You know, I'll take care of it. I got you covered. I'll be there for you. That's the attitude that they want. Can you work in harmony with your coworkers? Introvert, ambivert, extrovert. Understand your audience. Make sure if you're around like a certain generation or a group of people, who are you talking to? Who are you with? You know what I mean? So that's very important. Are you eager and willing to add to your knowledge of your basics and your skills? Problem-solving skills. Can you fix the issues? A lot of times it's like, oh, that's too much work. I'm not going to get paid for that. Screw it. But you can actually add that to your resume, and you actually can tell that to your boss. And remember, like, there's the stuff that's on your job description, and what makes you move up and out of there is when you start doing more than what you're supposed to be doing. You know what I mean? A lot of people, they'll just go there, I'm just getting it for a paycheck, so I don't care. I don't want to move up anymore. It's fine with me, you know, but I'm not like that, you know. I want to learn as much as I can. I want to move up. And loyalty and trust. Is there any more questions? You want me to go back or no? Or did I cover everything?
Yes, you covered it well.
Did I really? Oh, that's pretty cool.
I feel like that was very in-depth, actually.
Was it?
Yeah.
I think this is my best slide. Every slide I add on more stuff. Any questions? Go ahead, ask anything.
Do you consider to be your major sponsor now at Cedars, or even at Thermo Fisher? Sponsor, I mean, a person you can rely on. Midnight, you wake up and you see the sent you an email, an invitation, something like that. You feel somebody has to support you one way or the other. Who is your main sponsor now at Thermo Fisher and at Cedars? And why? You
So at Thermo Fisher, it's always the top performer, which is Ray was at trade production. I want to say Maricela and Tran and Lonnie, whenever one of them was not there, I was always, I could ask them for help. And in pre-production, it was Haneen, Jamie, and Sean, and even Jelly. Because everyone worked in different departments or different process was different. Because in pre-production, it's kind of like a week-long process, and certain times of the day, and there's certain sections, they hand off the work to other people, and they all could do the same thing, but on certain things, I noticed, oh, this person did this, person did that. Oh, this person did this pretty well. But the top performer was obviously in pre-production was Haneen. She taught me very well. She communicated so good. Her English was so perfect, it made me feel uncomfortable. I was I saying something dumb? I don't know if you ever meet people like that. Yeah. Exactly. So she was able to communicate with me very well and be very patient with me. She knew I was brand new, and that was something I could trust being around her. And at Cedars, from the very beginning, it was Odalie. Odalie was there for me. She fought for me. And to tell you the truth, because it is a startup and startups have different tactics on how they do interviews. I remember doing an interview at a startup, and they have a panel like this. And they're all asking you questions and stuff like that, and you're going back and forth. And then one department would be like, oh, I want to take this person. Oh, this person's pretty good. And then, oh, no, we'll fight for this. So when I got interviewed at Cedars, my first interview was over the phone with HR. Then it was Odalie and Peter. And then after that, I had Dhruv. And then when I came in, I was under the impression that I was going to be working with QC, because Odalie was the one that interviewed me, and I was actually going to go into manufacturing because I think they needed people, and I was able to balance the two. And when I went there and I did a tour and all that, and I met everybody. I told them, I was like, I guess I'm from QC, so they were getting this confusion, and I didn't know in the back end. While I was being toured, I think what was going on, Odalie was fighting to try to keep me, and she was always there for me. She was looking for me, and she was talking to me. And then, because she recognized me, she knew me, when I went into Lauren's office, she says, okay, so there's a bit of a mix-up, but we thought you were going to be into manufacturing, but we know you interviewed for QC, so we're going to have you decide where do you want to go. So, knowing that, there's a different department, and you guys met Odalie, right? Right, online? Yeah. Where would you guys have gone? Would you guys would have gone manufacturing doing T-cells? Or would you guys would have gone hang out with Odalie? Tell me where you guys would have gone.
That was a question for me from you. Immediately he texted me, where should I go? And you see.
Exactly. Like Odalie?
Only because of the impression that she gave me when we were asking her questions about Takeda.
Yeah.
Her experience.
That's exactly how I felt too. It was I didn't want to upset anybody. Because they wanted me in manufacturing, but then I'm like, oh, well, I guess hang out with QC. And then as soon as I went into QC, I was so happy to be in that department. She was always there for me. She was the only manager that was higher up than me. She was a scientist and everything. She was there making sure I did everything correctly, making sure I was working well with others, making sure my agenda was on point. And every day I went in there and I asked her, is there anything else you need from me? Is there anything else? Is there something that I can improve upon? We had this really good rapport with her. And she's very easy to get along with, and I was too. And I was so fortunate to have her be a part of my career and grow and be in there. And I think without her and Mamadou and other people that contributed to helping me understand the gowning process over there, like Daniel, it was something I can't explain, but it was a great feeling that I was a relief knowing that I went into the right department and that they were very open arms with me and they were very kind with me. Huh?
They had your back.
They had my back. And they were trying to establish that trust. And then I want to reciprocate that trust to her. And the same thing, I want to reciprocate that trust to you guys. And the mentality, and the attitude, and the gift. Because you guys have to take advantage of what you guys are learning here. Not a lot of programs do this. And that's why I believe in this program, and I believe in Dr. Aurora, and I believe in her teachings. And I believe in you guys too. Because there was moments where I wanted to quit. There was moments, she knows that. She's heard that.
Can you explain one of those moments? Because something I wanted to ask, because it feels like when people are getting to these biotech companies, it seems like, oh, it's wonderful experience, this and this, but there has to be something that, like, not make you question being there, but like, oh, I have to be careful, like, I don't want to do this mistake again.
Yeah. So that's something that like you have to like understand from yourself and which department and where you want to go and where you want to be in life. And for me, I remember I knew I had to weather out the storm because a lot of it was grunt work, a lot of it was chores, just like I showed you before in that one slide. You're probably showing, why is he showing me all these machines? Because most likely when you're there in the beginning, there's a lot of work that needs to be done, and sometimes those people don't want to do it. And you're going to have to be the person that has to do it because it's a job, somebody has to do it, and they'll love you for it. And they prepare you for it, and Dr. Aurora prepares you for it. A lot of programs don't do that, and a lot of schools don't do that. They just teach you the knowledge. Here it's a good balance of almost everything. You remember what Andy said? What he liked? Those exercises, right? Those
QC course that they will be enrolling most of them in spring. I offer only once a year.
yeah.
So QC course exercises, that's what he remembers. And I hope to bring Andy one day. He used to work at Michael's. He's the youngest one there. But if I may share, his quality was something that would stand out. He was doing a project just like you, and he will do what he has planned for the day. I will check the plan, correct it, he will finish and come around and help everybody. Like, Andy, what are you doing here? I'm done for the day. So I thought I'll help them. Rest of the team is doing what they are doing, they're documenting. He's done and he's helping everybody. That was his attitude. And same thing Carlos said at Amazon, he learned few things. He brought it to the table, he brought it to the practice. At Michael's, he said he used to arrange things. He was taking the orders. If he finds there is a big crowd at the checkout counters, he will come and help them. They loved him there just for that because he will fill in anything. Same attitude, just like Carlos said, if you have time out, do something. Ask somebody if you can help them rather than, it's my break time, I'm gone for 10 minutes. Go do the minimum, come back and ask somebody, can I help you in another way? And that takes you a long way. Actually, he has one unique habit that probably he will never say it. He might have mentioned, and I might have missed it today. He will come to me after everybody is gone. He will erase the board because he knows I never like to leave my signatures on the board. And he'll say, is there anything else I can do before I leave? Always ask. He's already done everything. He'll check every corner, there's no glassware left, and still he will ask, oh, I forgot something. Can you do this? Sure. You tell Carlos to do something, never have to repeat. This was my words for recommendation for him. Once you tell him something, you never have to repeat it. He has registered it. He will do it as if it is his honest approach to what he's doing, as if that is his signature. That's what I always mean when I say your work is your signature. He always exemplified that. His work is his signature. You never have to repeat, Carlos, can you do this? Done. Consider it done before you even expect.
I got you covered. See that? I got you covered.
Thank you.
Thank you, Professor.
I guess life is a mixture of ingredients. But when you get into a new workplace, and you have no idea, you're just beginning there. What's your game plan? I guess you have a sport and a team you could be supporting, and that team should have a strategy of winning the competition. You enter a new place, your workplace, you have no idea who you're going to be working with, you're just starting. What's your game plan? What's your strategy?
My game plan strategy is like to get to know the person. Start with small talk. Go up to them, ask them, you know, what brings you here? You know, like, where were you before? What can I learn from you? Who is the top performer? You know, I want to make sure I'm doing this correctly. You know, and what else can I learn? You know, and usually in the first month, you're just going to be reading SOPs. That's how it was at Thermo, and that's how it was at Cedars. I'm there just reading a bunch of SOPs. You're pretty much inactive in a way-ish, because you have to read the SOPs and you have to get trained on them. That's part of the training. You know, that's the informal training. Because everybody learns differently. You know, some people are really good at just reading it and they're like, all right, I got it. Other people, they have to read it and then see it. And some people are visual learners. It has to depend on who you are as a person. You know, are you a visual learner? Are you like someone that needs to be taught? Like, you have to understand your teaching methods and other people's teaching methods and asking a lot of questions. And that's something that, like, you know, using curiosity, that worked for me. That might not work for you guys, but have that in your mind and be curious about the world. Even if you already think you know it, stop. Look at it again. That's what I do. And it works for me. And I don't know, I guess other people do the same thing and some people do other things. Some people already get it right away.
You get signed off as a person that has completed tasks that will be considered as informal, for instance, reading of SOPs. There are documents to prove that you actually read and
Yeah. Yeah, at Thermo, they do quizzes, but this is what I didn't like about those quizzes, is that sometimes those quizzes weren't updated. They updated the SOP, but they didn't update the quizzes, which is a failure on their part, you know? And this is why I went to Ray. And Ray would know the answer. I was like, that's wrong.
So you see the quiz, and it has been noticed that the quiz is wrong and unupdated. And you only consult your coworker.
Yeah, I mean, they're gonna be there to help you most of the times. I mean, it's an open book test most of the time, and you should be okay. You know, like, those tests aren't that difficult. Her tests are way more difficult, which is I like, because it made everything else. Because then you have to take more attention to detail. But, like, you know, what you're learning, you may not even go to Thermo Fisher. You might go to a different department, a different place. Because I don't know how Grifols' process is, or Takeda's. I have an idea more what Takeda does, because I've done interviews. I haven't gone to their site. I'd like to.
I actually have a question about that. Like, the majority of the class, you know, we've only done interviews with Grifols and Takeda. What was your experience with them, and what was the experience with Thermo Fisher that stood out for you from Grifols?
So what stood out for me was the Grifols. For me, wasn't too bad. Takeda was a bit more difficult, and it still is kind of now, because I shouldn't say this, but I get calls from them. I'm on LinkedIn, so they're there, you know. But once you start learning more, it gets better. It does get better. And remember how I said you weather the storm? Like, you start understanding the process and you start understanding the industry. And they know that you're a beginner. And the reason why I tailored this a certain way is because I don't want you guys asking questions that are too advanced and then you can't get yourself out of it. You got to ask kind of like some beginner questions. Unless you are at that level where you're in that mid-level and you can ask more mid-level questions and like more like analytical or chemical or even microbiology stuff and something that you studied. It all depends on, and I don't even know who's interviewing you. You know, I got interviewed by Ron and Art and this other guy named Brian.
Getting stuck into advanced.
Oh, the questions?
Yeah.
Like sometimes like, because most of the jobs that are you guys are going to be offered are entry level. You're going to start in the bottom, you know, and if there's like a mid-level position, or even some of the questions that you might be asking might be too advanced. I tailored this so like it's more beginnerish.
I do not understand by how you as the interviewee asks a question that is too advanced. What do you mean by that?
I mean that what I mean by that is like the questions that I have here, they're not advanced questions about like what are the processes or anything like that. What's like certain things about like the regulations that you probably don't know yet, you know, or even like going into certain sections of the process and you're not quite sure or probably forget or you don't have that much experience in, you know, that these questions that they ask you, they want to see if you can work and they want to see if you can actually understand the process. And then later on, they'll throw in a lot more difficult stuff onto you. Because that's how they do it with me, and that's how they did it at Cedars. They're going to put you in something small, like, you know, it's like a training wheels. When you're riding a bike, they put you in something small, and then they get you a bigger bike, and then a bigger bike, and then they take off those training wheels.
What I heard was that you as the interviewee asking the interviewer a question that was too advanced.
Oh no, I don't want you guys having that. I didn't ask a question that was too advanced.
No, you can't ask a question too advanced. I can answer that. One of the students who had a degree, we went to, excuse me, Takeda field trip. And she asked them, they presented there what Takeda is about. And she asked, so do you have mass spec in your quality lab? What kind of instruments do you have in your quality lab? They did not like it. They did not like it. You could tell she was stepping on their toes. Said, oh, we can't really tell you all the instruments that we have. Asking us that you have mass spec, yes we do, but we really can't give you a list of the instruments that we have in our QC. That is an advanced approach. So on behalf of everybody, respecting his time, I would like to ask one question, and I'm sure you can answer that. What did this program give you that enabled you to become ready for transition to a job? Everybody is working somewhere. We all have some work experience. We are not exactly brand new to stepping into. What is it that made you emotionally or qualification-wise ready in whatever way to transition to a big company like Thermo Fisher or Cedars Sinai? What did this program give you as a foundation?
What this program gave me as a foundation was to understand that for me, like what drew me the most was QC, the QC program. Understanding all those regulations, understanding that, you know, that you're gonna consistently learn, consistently improve, consistently have something thrown at you. You always threw a curveball at us, and that's what life did. And that's what life did to Diana. Remember, she had a team, and the team basically abandoned her, right? And she had to present by herself. So that's sort of what you gave us as well in those exercises. That's what Andy was like as well. And understanding that, you know, the basics get you the job, like pipetting and understanding documentations, hands-on training, working well with others. That I wanted to bring that, whatever's instilled here is instilled at Cedars, and that's what I wanted to go after. I wanted to go after that. I wanted to be in that team. I wanted to have that environment, you know?
So this program in some way does give you a good foundation, and ammunition to start
Yeah.
any company and transition and make that career. It helps you with that transition.
Yeah, and not only that, you always, when you always talked about um, manufacturing process, you always changed it, and you always like, this program is up to date, and it shows. And I've explained all these items and everything that's here, you know, to be up to date to the latest version. Even like those C of A's that I showed you, you know, they have certain specifications are up to date, and that's something that you always taught us in every aspect, in every process, in every experiment. And I was like, are you doing it correctly? Are you following the SOP? And what I really liked the most that helped me was writing SOPs, and not just that, but the forms. Because the forms and cross-referencing a lot of SOPs actually helped me a lot. And that's something that I'm sure, like, you know, I mean, you'll have a workbook, but a workbook doesn't do it the way she does it.
And how about the techniques, the basic techniques that you learned in Biotech 2 and Biotech 3, or project-based learning or presenting the project? How was that experience for you? I know we were hit in pandemic exactly when he was there, so we only had halfway through. But I have never had more challenging a situation, and they still presented their project. How was your experience with that, project-based learning, as opposed to a regular class? I would just...
So project-based learning, I get that more at Cedars, because we all work in, like, you know, we do teams, we do a lot of video calls and everything, we do meetings on there. So I got very comfortable being in front of the camera and doing a lot of those presentations. Like these presentations that I gave you, this one right here, when I had like all my team right there, that's Jonathan.
Yeah.
Jonathan wanted this. We didn't have this before. You know what I mean? And
It
in
was
that,
a good thing.
it was a
prepare
good
you
thing to
with a-
prepare me for that. And I probably shouldn't say this, but I remember someone told me, I was like, Drew likes pictures in those presentations because it shows that you're engaged. And he likes like that you actually understand what's going on. And I actually had everything set up like that, and it actually looks happy. Other people did not have any pictures. Other people just had a white text, a white background and a black text. How would you feel as a teacher, or even a director or employer, or even here if I just came here and I only gave you a white background and a black text? What experience do you think you would get from that?
You should have taken a black background and white text.
Great. Thank you, Carlos. On behalf of everybody, I would like to thank him for his time, for his valuable presentation. Please join me to give him a big round of applause. Thank you, Carlos.
Thank you.
I would like to present to him
Oh, wow.
for holding this wonderful workshop a certificate.
Oh, thank you. Thank you, Professor.
It's my honor to have you. I'm very proud of you. Thank you for sharing your knowledge.
No, it's always an honor. Thank you, Professor.
you.
I always
Thank
try
you
to make you
very much.
proud.
Thank you. You always do.